Well, all morning here on Sunrise, we've been talking about prisons and planned reforms that are going to be announced later today to help tackle rising violence in prisons across the UK. So what's being planned? Well, 2,500 prison officers are to be recruited. This is to ease staffing shortages in England and Wales. There will also be an extra 300 sniffer dogs trained to detect psychoactive substances, which have been identified as a factor behind these surging incidents of violence. There's a focus as well on rehabilitation, with offenders to be tested at English and maths to monitor their development. And inmates will be tested for drugs as well, on entry and exit from prison. But we're asking, is that enough? Or will prisoners simply flout the rules and hide their drug use? Well, we can speak now to Edward Boyd from the Centre for Social Justice and George McBride from Volteface, a drug policy think tank that explores alternatives to current public policies relating to drugs. Good morning to you both, gentlemen. Edward Boyd, I'll come to you first. What do you make of these plans, first of all, for drugs testing? Prisoners to be tested when they start their sentence and then when they leave?
I think it's a great start and a great thing to hear that the Ministry of Justice are doing. It needs, however, to be seen in a wider context of a real effort to tackle drug addiction and make sure that prisoners get the support that they need in order to tackle that addiction. Because we know that about just under half of all, say, acquisitive crime, muggings and so forth, happen as a result of people trying to pay for their drug addiction, often heroin and crack cocaine addictions. And unless prison is effective at tackling that underlying addiction, people are going to often come out and reoffend quite quickly. And so this is why it's crucial to focus on tackling that drug addiction. And it's got to come, though, alongside better treatment inside prisons. There's too many people who have an addiction in prison who are trying to tackle that addiction but don't get the support that they need in order to do that. And I think alongside good testing to make sure we know who are taking drugs in prison, they need that support. So those two things just need to go hand in hand.
Yeah, George, Edward pointing out there that we're talking about testing when you start your sentence and when you end your sentence, but there's a long stretch in between. Not much emphasis given, besides sniffer dogs, the detail we've seen so far, on what goes on in the interim, what happens when you're in prison and you are addicted to drugs, because drugs can get into prison, from what we understand, quite easily these days.
Yes, that's right. Well, we've seen a serious cut in staffing, and I very much welcome the 2,500 new officers which have been announced. And I agree very much with Ed that if we're going to tackle reoffending rates and improve the public service that our prisons provide, then we need to tackle drugs. But what we need to do to tackle drug use in prisons is tackle the demand. And we've seen a huge increase in demand for drugs in prisons because people are banged up for 23 hours a day in what is essentially a toilet with nothing to do. And in order to get those people out, put them back to work, put them in training and education and treatment schemes, we need more staff. So spending money on drug testing, which can be easily fiddled and also doesn't do anything to address demand itself, is not going to help deal with that fundamental issue of the high level of drug demand in prisons. That's what we need to be tackling. And in a time of really low resources, we need to focus our spending on the things that we know that will work. And those things are treatment, opportunities, purposeful activity, getting people out of their beds in prison. We need to tackle supply as well, I understand that, but we've had drug testing in prisons for 20 years, and we've surveyed prisoners, and positive drug tests aren't a factor for them. It doesn't influence their drug use. These aren't things that deter people from using drugs. We need effective measures for deterring people from using drugs and positive incentives for them not to use drugs as well.
Edward, that's an interesting point. I mean, you can talk about rehabilitation when you're in prison, you can talk about cutting off the supply, but it's as much, from what George was saying there, about giving prisoners an alternative so they don't have to turn to drugs. They're not bored, which is always the reason you hear about, you know, children taking drugs on the street. They're bored, they've got nothing better to do. So the prison system needs to find alternatives for these prisoners.
I think it's important to separate out two things. First of all, you've got casual drug use, because someone might be bored in a cell. And then you've got deep-seated addiction to drugs, which is really hard to shift. And all the evidence shows that two things are necessary. Completely agree with George, you need the support there, you need good treatment, you need purposeful activities to divert people from it, give them something else purposeful to fill their day with. But the idea that you do that without any sense of accountability to identify, first of all, who is taking drugs, because that's what these drug tests allow prisoners to do, but then use that knowledge that you have about who's taking drugs to make sure that people are getting the treatment that they need. And so this testing is at the heart of an effective approach to identifying who are taking drugs, giving them support, and rightly sanctioning people where they are taking drugs because they're not engaging in the rehabilitative process that prisons should be taking people through. And one fact I think is important to get out there is that the majority of prisoners aren't tested during a year. The level of testing has been relatively low. Chances are, if someone is taking heroin or crack cocaine or legal highs, as they're known, which is happening frequently in prisons, most people aren't being tested at all. So the fact that there's a bit more is very welcome, but needs to go alongside the support, and taking out that sense of accountability alongside the support just isn't an effective way of approaching this.
How big is the problem in prisons? Because you're talking there about the differentiation between casual drug use in prisons and people who are addicted. Just what is the scale of the problem in our prison system?
Oh, it's one of the biggest issues facing prisons today. Of all prisoners surveyed who have a heroin addiction, 20% of them said they first started taking heroin in prison. That's the scale of the issue. When people come to prison, just under a third say that they have a drug addiction. So we know that, as I said at the beginning of the interview, that this drives 45% of all acquisitive crime. And just forget the human cost for a second. That is costing about £5 billion to the economy every single year. So fixing this issue of drug addiction is absolutely crucial to keeping people safe, to changing the lives of prisoners, to turning their lives around, helping them become all they can be, productive members of society. So I'd say it's fundamental. It's one of the biggest things that will make a difference to changing people's lives over this Parliament.
OK, Edward, George, I'll give you the last word on this. What do you think the government should be doing? Obviously, they're announcing their plans later today. We've heard some of them. In your opinion, what are they missing?
They're missing focusing on what's effective. These tests don't work. Some drugs can't be tested for, others only stay in your system for a day. So this is a complete distraction from the real issue of providing busy prison routines, well-staffed, safe prisons in which people have the motivation to stop using drugs, and in which our prison service has sufficient resources to tackle the supply of drugs into prisons and to give prisoners who want to change their lives the opportunity to get valuable treatment and opportunities to do so.
OK, George McBride and Edward Boyd, thank you very much for talking to us here on Sunrise.